everybody, this is Sophie from Physiotherapy, and today we're going to share a video with you on knee pain. So especially with the runners, cyclists among you, that you'll have all at some point heard somebody describe they've got a lot of knee pain, whether this is runner's knee, anterior knee pain, chondromalacia patella, IT band symptoms or syndrome, tendinopathies, bursitis. There's hundreds of different reasons that you'll have heard about knee pain basically. A lot of them go under a similar umbrella, so anterior knee pain, and then you've got patellofemoral pain, etc., etc. Reasons you could have knee pain could be, like I say, muscular, could be tendon, could be bursa, could be ligaments, could be joint pain itself, could be nerve related, or it could also be biomechanics. Today's video will target our non-acute symptoms. So if you've had any trauma, you've had a recent injury to your knee, you've got any swelling, you've got any acute pain, this video is not for you. This video is more for those suffering longer kind of overuse more related injuries, so tendon injuries, bursitis injuries, things where we need to reload the knee in the correct manner. A lot of these kind of injuries that we're talking about for this video are related to load management. So quite often, if you look back at your training diary, you'll sometimes see a spike. So these injuries I often see in clinic when people have suddenly taken up marathon training, suddenly made their return to track, and they've suddenly started increasing how much they do. The sun's coming out, the weather's getting better, they're doing a lot more. Or it might be that they've changed the type of training, so they might be doing a lot more speed work, a lot more hill work, a lot higher intensity. So these are some of the reasons that we might be getting knee pain. As always, this is a general video for general knee pain. If you have a specific injury, a specific problem, anything you require specific exercises or rehab for, then please don't hesitate in getting in touch and I'll do my best to help you. Okay, so without further ado, we'll give you some exercises. What we're aiming to do is to ensure we've got full movement of the knee, so we need full flexion, full extension, so full straightening and full bend of the knee. We want to make sure we've got good strength in that leg, we're not losing any muscle mass, and we want to make sure we're loading the tissues in the correct manner to really target them specific areas. This video isn't for a specific knee injury, but general knee injuries, okay? So as I say, really get in touch if you have got a specific injury. Prior to doing this video, if you want to do the foam rolling video we've put on, that'll be a real good help because it helps loosen off all your legs. Also, alongside this video, I'd recommend doing the glute video because, as you'll hear in the glute video, glutes have a really good job in helping stabilise, which has a knock-on effect from hips, knees and ankles. So a lot of knee injuries can actually be helped by doing a lot of glute work as well. So without further ado, let's get cracking. So basic advice, heat, ice as you wish. Often for tendon injuries now, heat's promoted. We want to promote blood flow to the area. If you have got any irritation, swelling, or you want some pain management, ice can be good. So 10 minutes of each, use your judgment as to which one you prefer. With things like bursas where they can get irritable and flared up, I would avoid kneeling on them. Tendinopathy type things, I'd avoid any increased stair work, increased hill work. So sometimes it's a case of you're able to do your exercise but reduce the stuff that irritates you. So the aggravating activity, whether this is hills, stairs, I would reduce this. Equally, if you're into multi-sports, I would avoid the aggravating activity. So if you can still cycle pain-free, cycle. However, you're running, you need to reduce. A lot of the research for tendons will say if we can give it 48 hours to recover. So with these kind of knee injuries that we're talking about, if you go out for a run today, it feels good, then I would have the next day off and then repeat the following day. Don't be tempted to go out. So give it that good 48-hour stint to recover. Okay, so we've got 6 exercises to do today. Make sure that you really look at your form, really make sure your technique's good, and as always, any questions, please don't hesitate to ask. So, like I said, generic, so we're just going to wake up different muscles around the knee joint. So to start with, we're going to work on this VMO, so the muscle, the inner knee, so the inside of your knee. In long sitting, what we're going to do is turn our foot out. So we're going to face our toes away from us. In fact, I'll show us on our right leg first. So we're pointing the toes towards the camera, keeping this leg lovely and straight. Our quads are nice and strong. From here, we're going to lift up about 30 centimetres for 10 reps. 3, 4, 5, 6, 7, 8, 9, 10. Good. I would always recommend doing both sides. If you're short of time one day, obviously focus on the injured side, but like I say, if we can, we'll do both sides. So 10 again, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. If you don't want to sit that high up, you can rest a little bit further down if it's more comfortable for your arms. Same principle, 10 again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Onto the other leg, keeping them toes turned out, keeping that quad nice and strong. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, nice and controlled. Let's do one last set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, stopping sides. 1, 2, 3, 4, 5. Really lock that quad. 6, 7, 8, 9, 10. Good. Coming into standing this time, we're going to do a wall sit. So with our wall sit, we're going to lean against the wall. What we want to do is aiming to get down to 90 degrees, keeping our backs nice and flat and making sure our feet aren't under our knees. So our feet want to be level, so everything's at 90 degrees. So once we're set, we're nice and comfortable, nice position between our knees, we're not knock-kneed, we're going to hold it here for 30 seconds. Good. Try not to lean on here, try not to cheat, we're just going to hold it here. Good. Keep nice and relaxed, keep your breathing. So really good isometric contraction of our quads. Really good for any quad injuries, any knee injuries, so we're just keeping that muscles working but without actually moving them at all. Good, we've got 10 seconds to go. Really feel it working, really feel these quads. 5, 4, 3, 2, 1. And relax. If you wish in your own time, you can challenge yourself and see how far you get each time. So maybe just today we've done 30 seconds, see if tomorrow you can do 45, etc, etc. This time we're going to do a little bit of proprioception. So all we're going to do is standing on one leg, we're going to have a little bit of a bend through the knee. So if I show you here, slight bends like a single leg squat. We're not going to let it knock knees, so we've got to keep this gap between. All we're going to do is drop, tap in front, tap to the side, tap to the front, tap to the side. That's 2. Okay, so we're going to do 3 more, 5 each side. Tap to the front, 3, good. 4, notice how my leg's staying straight, my hips are straight, I'm not dropping at all the way forwards. 5, good, and 5 on the other leg. So tapping forwards to the side. 1, good, 2. Work that range, so into that single leg squat, but in that pain-free range. 2, good. Good, perfect. This is a really good one for proprioception, so control of the knee's awareness of where it is in the body, making sure we're not knock knees, so keeping that good stability through. So again, if you wish, you can do another set of that. However, for the purpose of this video, we're going to fly through and do our last couple of exercises. So this one's a hip drive exercise, so really good on our runners and our cyclists when we need that power through this position here. So all we're going to do is nice and tall. Standing here, we're going to drive up, back down, up, back down. So if I show you from the side, from here, we're just going to drive up, down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. And swapping sides, move my weights out the way. Good. So the same again for me. From here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Let's do one more set of them for me. So back the other way. And drive up. 1, 2. Good. Really think that form. 3, 4, 5, 6, 7, 8, 9, 10. Good. And this side. Last 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Then 2 more. We're going to do 5 this time, so similar position what we've just been in, but a bit longer stance. You can't be close on this one because it won't work. So nice big stance. From here, use the wall if you wish. We drop down, push up. Drop down, push up. So we're going to go for 5. Keeping our hips forward, chest forward. 1, 2, 3, 4, 5. Swapping sides. So it's our split squat, everything in line. 1, 2, 3, 4, 5. Good. Let's do 2 sets of this one. So back down again for 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5. Good. And we have one last exercise for you. So I've tried to work a few of all the muscles, but especially those targeted into the knees. So our last one's called a bridge walkout, which I find really good in all-month runners. But it's good for all exercise really, because it's a really good eccentric control of our hamstrings, which come and support behind the knee. So for this one, into our bridge position. From here, we're going to step forwards, 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 forwards. Hold. In, in, in. That's 1. If we can, we stay up. If you need a rest, you can come back down. We go again. We've got 4 to do. Up, out, 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 in, 2. Out, 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 in, 3. Last one. Out, 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 in, 4. And relax. One last set to do, and then you're done. So, from here, into your bridge, out, 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 in, 1. Out, 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 in, 2. 1, 2, 3, 4, in, that's 3, last one, out, out, really work them hamstrings, in, and relax. Well done everyone, so that's your knee video done. So hopefully you've learnt a little bit about your knee. Also some exercise to really wake up all that area around the knee, work on some strength, some stability, some proprioception. So we've covered a lot of areas there, but as always, if you need a specific plan, anything individualised, please be in touch and I can be more than happy to help you. Please contact via the Facebook page, facebook.com/SophieMar Physiotherapy, via Twitter at @SmarPhysio, or via the website itself, www.sophiemarphysiotherapy.co.uk. That's all for now. Take care. Bye bye.